Hello there. We are very happy once again to be before you, especially today because we are having a very special guest with us. She is the Associate Director of the Global Health Institute for Loma Linda University, and I'm very pleased to introduce to you Mrs. Jan Zumwalt.
Yes.
It's a pleasure having you here with us.
Thank you very much.
All right, thank you for coming. How do you enjoy Côte d'Ivoire?
This is my first time to the Ivory Coast,
Yeah.
and so I'm really happy to be here.
It hasn't been raining so far.
Yes, the weather's been good. I brought my umbrella because according to my weather station,
Yeah.
it looked like it would rain,
Rainy
but it has
season,
not.
yeah. All right.
Yes.
Could you tell us more about yourself, some biography about you so the viewers could know more about you?
Okay.
All right.
I'm Jan, and I am a nurse. I've worked at Loma Linda University, where I graduated. I've worked for the medical center there for just over 40 years since I graduated. I started out
Quite a
working
long time.
in the, a long
Yeah.
time. I started working in the critical care nursing department as a staff nurse, and then got into nursing administration in critical care and acute care nursing, and have done that for many years.
All right. Well, where are you from? Which country are you from?
I'm from the United States and from California,
All right.
from Southern California.
And you
So
work.
everything looks very green and nice here.
Yeah,
And
because
Southern California is very
you
dry.
guys have lots of fires
We
there.
need your rain.
Yeah, yeah, and I'm sure the Lord is listening. Anyway, all right. Now, you have put together the Global Health Care Conference, right?
Yes.
Is there any difference between health care and health?
Well, I think health care is a subset of health.
Okay.
The conference is particularly focused
Yeah.
for people who work in hospitals,
Right.
administration, the leaders that work in the hospitals.
Okay.
So it could be the administrators, the chief nursing officer, the chief medical officer,
Yeah.
the chief finance officer,
Yeah.
and it's that group of hospital leaders that this conference
So-
is focused
So
on.
it's more of an administrative meeting, if I may
Yes,
say.
right, right.
All right. Now, what is the purpose of the Global Healthcare Conference?
Well, we want to share information with our Seventh-day Adventist hospitals,
Yeah.
and particularly the hospitals in this conference, the hospitals that are located in the West Africa area.
So within our division, the West Central
Right,
Africa division.
Right, right.
All right.
And so what we want to share with them in this conference
Yeah.
is information about good financial management for hospitals. That's always a challenge
Definitely.
in the United States and very
Definitely.
much here in
Yeah.
Africa as well.
Yeah.
Quality improvement is another area.
Yeah, definitely.
It's something that in the United States we've done for many years, but is maybe a bit newer here in some of the
Sure.
African hospitals.
Definitely.
And so we're also talking about the board and governance for the hospitals. And that, of course, is the people that do the overall
Yeah,
strategy and
true.
approval for big plans and so on for the
All
hospitals.
right. Now, how often do you organize such conferences?
Well, we have been for the last few years been doing these conferences on the even years at Loma Linda. And
Okay.
so we invite people from Africa, from Central America, the different divisions to come to Loma Linda
All right.
for a conference. And then on the odd years,
Yeah.
we go and do a conference in another area of the world.
In another area of the world. I was just about to ask you, in what places in the world?
2 years ago, so
Yeah.
this would be 2013,
Yeah.
we held a conference in the Dominican Republic for the Inter-America Division
All right.
hospitals.
Okay, so everyone came down there.
Yes,
All right.
from
Now,
that area.
do you have some specific themes that you have once you hold these events?
Well, you know, what we think is that it's important to have the conference be interactive.
Okay.
Not just a conference where somebody stands up and talks all day and maybe I just snooze.
Yeah, true.
We want these conferences to be interactive, to be productive, and we want the participants to go home with some new ideas and some new plans for things that they're going to do at their hospital. Right. So we sort of joke about it at home. Yeah. We want people to do their homework.
True.
When they go back home and then before they come to the next conference.
All right. So you could have a view, an approach to the conference.
Yes. So interactive. Yeah. So in these past 4 days, today being the final day, we have had panels. Okay. So panel discussions, many questions from the audience. Yeah. We have had work groups from different hospitals. They sit at a table together and talk about a quality issue that they want to improve. Right. And then specifically, they come up with a plan for how they're going to do that. And then this morning they were presenting these plans, and so
they did their homework.
They did their homework, yes. And then several people that are speakers and administrators for this conference listened to those plans and gave them suggestions and asked them more questions and gave some more things to them to think about and to consider.
So they brought in their expertise.
Yes.
All right.
Yes.
So as to help them out.
Right. Right.
All right. I can see a lot of people involved in the organization.
It's a big job
putting this event together.
To put one of these conferences
You're talking
together.
about approximately how many people?
Well, in our Global Health Institute, we have had 2 people working on this for nearly a year.
Nearly a year?
Now, they've put the most intensive work in the last couple of months, but you can't just start planning 1 month or 2 months ahead.
Definitely.
And in fact, 2 of them came over here to the Ivory Coast and visited the division headquarters here and worked with the leadership here as to where the room would be and who would cook the meals and what might be good places and cost-effective lodging for the group.
When was that?
Because we have a group of nearly 100 people here.
And when have these 2 people come?
How long ago? It was in March or February, March of this year. Yes.
All right. So they were checking on everything to make sure everything was done right, to make sure there was quality.
Yes. Right.
So it's part of their habits.
Right. Yeah, we are trying to improve each time we put on another global healthcare conference. Improve what we're doing and make it more useful and beneficial to the attendees.
All right. And
you know, one of the other things that's very beneficial is the networking between the different people from the different hospitals.
True.
Like in this conference, most of the people have not met each other. Some of them have, but many of them have not been to a global healthcare conference before, and so they don't know each other. So it's really fun to see them meet and dialogue and get ideas from each other and collaborate. We want that to be an important part of each global healthcare conference.
Very good, because I heard someone talking about a system making our medical centers system stronger, and this networking opportunity could be a great one in order to do that.
Yes. We have a charitable organization that we work very closely with. Dr. Hart is the president of this organization, the Adventist Health International.
AHI.
AHI, yes.
I heard about it.
Yes. And so there are a number of AHI hospitals in this area, in the West Africa division. And so they, along with other hospitals in the area, are
Oh.
here. You'll have to ask Dr. Hart
All right.
about that. He is
I
the
will.
president of that organization.
We
and
will. We will have
it's
some time.
Yeah.
Yeah. All right. I saw that you have an evaluation questionnaire for every presenter
You're right.
at the Global Health Care Conference. What is the purpose of that? Because it's a detail that really struck me. I was like, wow, that's amazing. You know, they work
Yes.
in such a an organized manner. And
We have a syllabus here that is given to each attendee.
yeah,
And there's a tab in here for each day, and the schedule is in here, the goals
Yeah.
and the objectives
yeah,
of each lecture is in here. And then we have, oh, I've turned some of mine in already. We have
It's
an
all right.
orange evaluation form
yeah.
for each lecture and
you
each
show it to them?
speaker. Yes,
All right,
yes.
that's what it looks like.
And so for here, the front side is in English,
yeah,
and then there's the back side or a separate one, depending on how long it
Yeah.
is in French.
yeah.
So you can choose whether you want to fill out the English or the French one. The purpose of this is for us to learn how are we doing
True.
and what can we do to make presentations in the future
Yeah,
better, more applicable, and more helpful to the people who
True.
will be listening to them.
true.
So we also give each presenter a report of how they have done.
Okay.
There's no name that goes on these evaluations, so everybody feels free to say what
Yeah.
they feel and what they really think. And
Yeah.
it's those sincere thoughts that they
Yeah,
have
yeah.
that are most helpful to us.
True.
And then we collate those all together and give them to the speaker as well.
All right. Well,
That's how we learned that
that's-
it's better to have a conference where there's more discussion,
Yeah.
more interaction, more things for the attendees to participate in and do,
true.
because they want to be doing something.
Yeah.
Interacting with the information, I think, helps them remember it a little
True.
bit more.
Definitely is a wonderful approach to learning and to share as
Yes.
well.
Yes.
Well, have you got some statistics about the number of medical care or medical centers, Adventist medical centers in the world?
Yes, I believe there's probably about 75 hospitals.
75 in the whole world?
Well, and then in the United States, probably another at least 75.
175.
I think total there's 150 or 170, and half are in the United States and half are in other parts of the world. And a number of those are in Africa, though
Wow.
I've not counted the exact number in Africa.
Wow.
But it's a lot. Now, if you count clinics, there's many, many more.
All right. Is there a difference
Hundreds
between
of clinics throughout the
what is the
world.
difference? What is the difference between clinics and medical centers or hospitals?
Or hospitals.
What is the
A
difference?
clinic is a place that is usually not open 24 hours a day, maybe just opened Monday through Friday,
Right.
and a place where if I'm not too ill, I will go and see a doctor, just like going to a doctor's office.
Okay.
And so the doctor, you know, may give me some advice, some
Yeah.
suggestions, order some blood tests,
Yeah.
and hopefully I'll get better from that.
Right.
But if I was sicker and needed something urgently
Yeah.
or needed to have closer observation, I would go to a hospital.
The hospital. Well, I'm asking you this question because usually in Africa we do not make that difference. For us,
Okay.
everything is the same. So I thought it good to
Yes,
explain so that it could be
yes.
clear to many of us.
Now, the word healthcare
Yeah.
refers to clinics and hospitals.
All
It
right.
can refer to both, very definitely.
All right. Yeah. Good
Yes,
point. Good
yes.
point. Well, could you say that all of these events the Global Healthcare Conference and all, the way you organize it throughout the world, in different places in the world, is coming from the impact that the Loma Linda University is having on the medical mission?
I think there's definitely an impact, and one of the big impacts, I think, is a program that we have where young medical graduates, so from medical school, the physicians will take a residency, a specialty. Might be general surgery, family medicine, internal medicine, OBGYN.
What is that?
OBGYN. The obstetrics and gynecology. So the obstetrics is the delivering of babies, and gynecology is female diseases and problems.
All right.
So, and there's many different specialties like that. And so one of the programs that we have is a deferred mission appointment. And so physicians, while they're in medical school, can decide that they would most likely like to serve abroad after they finish all of their training. And so the General Conference and Loma Linda have a plan where they partner together to pay the loans. It costs a lot of money to go to medical school these days in the United States, probably here too. So they would not be able, because they'd have to be paying off their loans, they would not be able to
pay themselves,
go as a missionary. And when they could go after they paid off their loans, by that time they've got families and car payments and house payments and all sorts of other things, so it would make it difficult to go. And so this allows them to pay off their medical school bills through the General Conference and Loma Linda Partnership and serve as missionaries.
Yeah, definitely. Well, would you?
And so so they are in a number of sites in the West Africa Division.
Like where?
And we have several in Chad.
Yeah, I saw some.
Chad.
I saw some of them. Yeah.
Yes. And then in Africa, we've got a number in Malawi. Yes.
All right.
So, and there's other places as well, but those are the two countries that seem to have the most.
There is some impact.
Not in Ivory Coast.
Not yet. We need you guys.
Yes,
We will be. We're really praying to have some medical facilities here. So.
But they do training, which is very helpful. And hopefully, when they're done, the plan is for the local doctors to be able to just carry on, and so it will be very sustainable.
All right. Well, now, what makes, according to you, what makes Loma Linda University so successful in the work they do?
In the international work that we do.
More precisely in the mission work.
Yes. I think it's in our genetics at Loma Linda.
Wow. So I think I'll travel there, so I could just be there.
You have not been there?
No, not yet.
Oh, you need to come and visit us.
I will sometime, hopefully.
In the early years, in the medical school, the name of the medical school was the College of Medical Evangelists. So when my father graduated from medicine many years ago, he graduated from the College of Medical Evangelists. And the goal for the medical graduates was to have them go abroad and to serve in other countries around the world. Hence the name Medical Evangelist. And so I think it's this long history of international service that that really helps us become and has made us very successful. It takes time. It would be hard to just start now. But it's in people's thinking. I think many of our students come to Loma Linda because they have an interest in international mission work. And these days, the younger people the world has become very small.
I know.
With technology and communications.
Yeah.
And so I think many younger people these days
Yeah.
have an interest and a curiosity, and they want to experience the world and get to know people in other countries and
Yeah.
other cultures. And so at least I've noticed the interest is definitely on the rise
All right.
for interacting and working with people abroad.
Christ is coming soon, and the time is short.
Yes.
And
yes.
it's good to know that as we see younger people getting to the work of God, we will be seeing Christ pretty soon.
Yes.
Yeah, because
yes,
this is our
yes.
goal. I think so.
It's definitely
Yeah.
our goal.
All right. Now, one more thing. In the course of your ministry as a nurse, have you been witnessing the power of God in the healing of the people?
You know, probably my best example of that is in China,
Okay.
where I've worked there for a number of years
as you
with some
said.
projects that we have there.
Yeah.
And people have not known so much about God, but as they interact
Yeah.
with people from Loma Linda and other Christians,
Yeah.
after a while they start asking, why are you coming here? You wouldn't have to do this.
Yeah.
And why are you interested in us? I find that they ask a lot of questions, which makes it very easy to share,
True.
you know, God and our beliefs
True.
and our support and love for each other.
Yeah.
And it has been a wonderful experience.
Wow. Thank you. Thank you so much. Well, I think that the genetics you're talking about is the love of God within the heart of the people.
Yes.
Because Christ had been doing so much healing because of his love for us. And somebody mentioned one day that we are the extension of the arms of Christ. So I think all of your graduates, all of your people coming from Loma Linda have that passion for Christ and have that drive to show the love of Christ. And this is an incredible blessing, and I'm really happy for that, and I congratulate you. May the Lord bless your work. May the Lord bless the Global Health Institute and the work that you're doing. Well, as we're coming to a close, I want to ask you if you have one thing to say to our viewers regarding their health, regarding the mission work, regarding all of these things that you're doing. What would you tell them if there's one thing that you have to tell them?
I think I would say health is multifaceted. So it's about eating correctly,
Yeah.
not too much in either extreme.
Too
I
less.
like to say come to the middle.
Yeah.
I think it's about being relaxed, keeping your stress down. For me, that is going out and walking outside.
Okay.
And I
Long
like the
walks.
open space, yes.
Okay.
It's a stress reliever for me. I think it's getting enough sleep, which I need more of, especially after
As
the long flight over
myself
here.
too. Yeah.
But I think there's numerous things that one needs to do, but they're all
Right.
fairly simple. So I would definitely encourage the audience to think of these things for themselves.
All right. Thank you so much, Jan Z, right? It was a pleasure having you with us, sharing about the Global Healthcare Conference going on in our division, the West Central Africa division, and in some other parts of the world at some other time. You told me quite a few minutes ago that next conference will be held in Zambia.
Yes, immediately following this conference is one that is almost similar in content,
All right.
to be held in Zambia, in Lusaka, for the divisions down in that area.
Yeah, so they're in division something.
There's actually 2 divisions, yes, and I get those names confused.
Yeah, myself too. Well, thank you once again, and we wish you good luck. May the Lord be with you and continue to bless you in your ministry, the Global Institute, with the Global Institute. Well, it was our pleasure to present to you this interview with Mrs. Jan Zumwalt from the Global Health Institute for Loma Linda University. Till then, may good health be your portion in the name of Christ. Bye for now.